Hi everyone, Eli Reshef again. I'm a board certified reproductive endocrinologist and infertility specialist, having done that for over 33 years. Today's topic, complicated one, stress and infertility. As a disclaimer, I'm not a mental health worker. I am a physician who subspecializes in the field of reproduction, but I also have a high sensitivity to the area of stress through my years of providing clinical assistance to patients. So it's very important to recognize that stress is a significant factor of the infertility evaluation and treatment or the infertility journey. This is oftentimes the first major crisis for individuals who are trying to get pregnant and are unable to do so, because the majority of them are people who are otherwise relatively healthy and have plans. And when those plans do not materialize, it can create significant amount of discomfort, stress. Um, the consequences of stress are significant. And both the patient, their significant others, and especially the physician need to recognize that. What can stress cause, or what's the role of stress in infertility? First, we know stress is very common. It's almost universal when you are trying to conceive and you have not been able to do so. Secondly, we do not have direct evidence that stress can cause infertility. However, treatment strategies to deal with stress have been shown to improve pregnancy rates. And how it does, we don't really know, but clearly when you lose your coping mechanisms and stress degenerates into low self-esteem, depression, anxiety, sexual dysfunction, and otherwise, using strategies to improve on all the above or treat all or some of the above may be very helpful for you, not only to cope with your journey, but also perhaps even increase your pregnancy rate. So, a relationship between stress and infertility have always been debated, but yet we know that certain strategies for stress reduction have been shown to improve not only the coping mechanism, but also pregnancy rates. So, extreme stress, extreme stress, either it's persecution, starvation, and otherwise stress that can cause in women reduction in regularity of the menstrual cycle, etc., may be associated with infertility by interfering with ovulation. Most stress, though, is not expressed as periods that become irregular or stop. The most important thing for me as a physician is to recognize the role of stress and not forget it, because we're so involved in the technical aspects of the clinical aspects of fertility, the evaluation, the treatment, etc., in vitro, surgery, that we sometimes omit the very important aspect, which is stress. So we need to recognize it in our patients, ask about it as physicians, and also offer treatment strategies, or at least a referral to somebody who's well-versed in treatment strategies for stress. For patients, it's very important to recognize the role of stress. And sometimes it's very important to say, what are we doing here? What are we trying to accomplish? Are we destroying part of us, part of our relationship, and the enjoyment of life by being so preoccupied with getting pregnant, which is obviously a noble goal, but yet can be a two-edged sword. So, for the physician, recognize that your patient is stressed, ask about it, and then offer treatment. What kind of treatment strategies can we offer? Mental health professional, a counselor, somebody who's expert in sexual dysfunction, or strategies to reduce stress, such as yoga, mindfulness training, mind-body training, Pilates, exercise, transcendental meditation, even prayer. All those techniques can be helpful For the patient, it is the recognition that those strategies can help and can really mitigate or reduce the deterioration into problems with the marriage, problem with interpersonal relationship, problem with sexual desire, and things of that nature. So, believe it or not, especially if the patient is younger and has not traveled through the infertility journey for very long, I sometimes will recommend for the patients to take a break, pause, look at life, look what's important, prioritize. Um, it's sometimes hard to do when you're in a part of the roller coaster of trying to get pregnant and you don't want to stop. You think you're going to lose something if you take a break, and it's not. You need to recharge. With regard to sexual dysfunction, which is very common, it's males, females, erectile dysfunction in males, reduction in sexual desire, and all that. I oftentimes ask my patients, if they complain about that, what happens when you go on vacation together? Do you get it back? And if they say yes, then clearly it is the daily routine and the journey that may be causing all those type of complications. So I say, first of all, realize that we don't have necessarily medications that can help there. Sometimes they do, but some of the antidepressants may actually cause sexual dysfunction or desire dysfunction. So we have to recognize that. So let me summarize, because it is a complicated topic, and one I'm very qualified to discuss it, but not to treat it. So recognize that treatment modes or relaxation modes or mitigation modes, whatever you call it, are there to help you. But as a patient, you and your significant other need to recognize that that could be a significant issue, and that treatment strategies can actually improve your coping mechanisms and even your pregnancy rates. Thank you.